my table back of knee and that I can do this to this. I also always give a lesson with my sneakers on because again, my proportions. My shoes are off, then I'm already down here and it just, I can do it. I'm actually pretty able. The table is your home and you really should feel comfortable on it. I will say for parents, this might be cute on the floor, but especially if your child is a bit more to work with, your back is going to be a lot better off, even if you just use this thing as a changing table for those that'll need it because you're there. The lesson is going to be influenced by where you're at in space as well as where the person's at in space. That being said, I hope you've already seen with this morning, you know, once you start seeing a lesson, yes, it's easier to say, okay, lie down flat. Well, first of all, kids are not going to offer you that. If they do, they're already, you know, having issues and that's why they're there. But two, we're three-dimensional bodies. So if you learn to do a movement, I literally can do a lesson on an airplane. It just, you know, now would I want to work at 9 to 5 on an airplane? No. And one of the things we'll do, hopefully, by our second or I do it in the third segment, but it depends on too with the weather. But it'll probably be next. We'll go in the water, and you really can see too how movement it works and stuff. But I'm not going to work in a pool, you know, 24 hours a day like some people do. But here we have tables at various degrees and some tables still can be adjusted, but as you can see, like that table, this table is quite low. If that's your preference, play with it, and not that you have to stick though to one table. Please, you know, don't let your brain say, I only like to work with her in this position and her in that position on this table. Let yourself just go, okay, we're on here and we'll be using the benches. I'll show you how to work in chairs. I'll show you how to work, because people will just be in different positions in your life, and that's where the more available is. It's like you can drive 15 different cars. I can ride motorcycles, but most people will be, you know, but if you put me on a skateboard, I'd totally be 18R. I mean, it just wouldn't happen. Movement is just natural. So to explain again what was asked about counterbalance, counter opposition, no matter how I move this water, it will always go with the horizon. It counterbalances me. So no matter what I do, no matter how I pick this up, I will never get this water to tilt the opposite way. It's just, and that's counter-opposing. So when I work with a baby, that baby, no matter what, their systems are responding, and this is what I call the absolute horizon, that they can just feel where they are in space and get their natural. So now babies will engage in this position for a while, and then they'll start transferring, and then they'll learn their absolute vertical, which will come around the 5-month period where they start to stabilize their head and stuff. And once they have a good absolute horizon and absolute vertical, that's when they can start now moving around within their space to actually create a movement. Whereas at that age, younger, they're responding to stimuli. Yes, I get it that they can grab a bead or whatever, but the actual start creating of movement comes when you learn your absolute horizon and your absolute vertical. And so you can see where right now, where she's in squat pose, that she's learning her absolute horizon now in a 3-dimensional. See how her spine does all of that and comes down at the same momentum as it did going up. Probably should have a... I know, you're so talented, you little thing. So now, if I have CP, this is my momentum. It doesn't, so when I'm saying don't rock, do you see the difference of what that water alone can be very violent with very little movement? Now I can have this violent movement immediately to rotation and it's gone. I can go that fast with rotation, but if I don't have rotation, so you can practice yourself. If you're sitting up there trying to give a lesson, even practice here, trying to do rotation, it's not the same quality as here, right? So no difference for dance, all your other kind of physical therapies that you're doing. So we'll be passing around the bowls tomorrow morning. But when I'm working with someone, it's not that I'm working to sitting them up, whether it's you or that, but I really want to make sure that that movement has a quality within your body, even if you don't know it. So another way of looking at it, and by all means you all have water bottles you can play with. This I'll pass around. I love this guy to start learning. So now again, if I'm quite violent with this, not only that, but you see I have two tempos. That water bubble, the air bubble is giving a completely different movement to that, the viscosity of the blue. But again, if I immediately go rotation, not only that, but the tempo is the same. And see again, now that's a complex counteraction. And this is what we don't think about when we're working. A lot of people think of the floor and the spine and your vocabulary, but you really have to start thinking of lung quality, your esophagus, how I'm swallowing, around my heart and lungs, and all of this. The human body is so complex when we start thinking of movement. The reason I really took that path, because I really realized with my son having his sinus infections, that when his mucus changed to a thicker viscosity, his movements became very impaired. And I realized, why can't you drive a car when you have the flu? You know, our bodies are really set up for a certain tempo within and movement. So when you do have issues with cardiovascular, diabetes, and so forth, they really start to affect the system, rheumatoid arthritis and stuff, in a way that we just don't give our systems credit. So if you could show any system improvements with this, then they will improve cognitively as well as physically. I can't get rid of Parkinson's, I get it, but I certainly, we can have Parkinson's here versus here, as an example. I mean, there's some things you just, you know. My mom just passed away of cancer, and it was really fast. The tumor doubled in size daily, and when she passed, she literally looked like she was 12 months pregnant. It was all tumor, from here to here to here. It was just a giant mass. I don't know how she was even eliminating at that point. But up until moving her to hospice, she was in no pain and she could transition. But when they moved her into the facility, the move was rough on her, physically and mentally. She was just fatigued. So then she put off lessons for like a day or two. She just didn't want to be touched because it was already too much. And after that, the swelling, the edema, all that stuff just kicked in immediately, and I couldn't chase that ball. But anyway, I'm going to pass this around. Please play with it. Any questions with that so far? Yeah.
All the parents give the babies a shake.
Right.
What do you see? What is doing for a baby?
Someone's getting tired. I try and show by example. I try not to become too much of a bear, like don't do this because again, the kids don't come with manuals, but you'll see it, I see it much more in Asia, the roughness. Literally I did the newborn assessment in the NICU and turned around and the nurse went back to, with this like kilo baby in the NICU, and I'm going like, oh. I try and just either do something like this to show as an example so they have more of a visual, takes the baby away from it, that they can say, oh, okay, I get it, you know. Or I touch them to show just that movement. But as I like to say it, and I'll say it a lot, we're only wiser 5 minutes after the fact. And some people, we do what our parents did and that kind of thing. But at the same time, if a parent suddenly takes a child off a table, I don't say, oh my gosh, everything I just did to this child is lost. If the work is that delicate, then you shouldn't be doing it. It really, and two, sometimes the parents just came from jail, you know, I mean, like, and you're going home to a hot mess of 6 kids, and I'm there for the child. I'm there to help the child's life. I do what I can, but sometimes, you know, life's just not perfect for the environment of that child, or, but I have to trust that everyone's an adult and they'll do what they know is best, and all we can do is show by example versus telling them what to do. But I wish I had a do-over. I had my kid he loved to be in that bouncy chair, the one that's like the disc around. Graham was so content in that thing. I would have burnt it at night. So again, just to get into the medical side of it, when I'm dealing with rotation of the chest cavity, do you see how delicate that I need to be like this to just allow that, what if that's someone's chest with pneumonia, or they have a heart failure going on or blocked arteries? You really need to show that way of being delicate versus suddenly turning them like this, where just their internal organs will have a fall. You'll kind of notice that with Bo a little bit. I really want to work on him. I don't know if you notice with his chest that in certain positions he has a very phlegmy response and stuff. So he's going to have to worked on a little bit differently, because his system's going to go into a startle just because of this bronchial cause. And you'll see that too with her having small nasal cavities. When they roll over, they almost feel like they're drowning, or they're getting, like, in the ocean, when the ocean just hits you up in the nose, you get that, where that'll affect their movements. I don't care. But if you do that right next to the camera, it really picks up. That's all I'm saying. They wouldn't hear a word. Da 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 da. No, don't stop it. Just pass her around. Let her play with everybody. Yeah, see? Let her go get Enrique. Glasses. It's not his first rodeo. He's good. He knows. Any questions so far? Is it neat to touch that blue thing?
Yeah.
And you can see too how light your touch has to be.
Exactly. It's perfect for it to be an example of how light you need to be. How gentle you need to be.
But you can go really fast, and if you have rotation, add the rotation. You'll be able to tell if the rotation's not in there by how the liquid's responding to you. And like I said, most of you should have water bottles, and you should be able to just see that. But can you imagine, even at 9, if I'm startling, what I'm doing to my system and how it gets affected? The last 2 bits that I'm going to go over, and then why don't we not break. Let me do a lesson. We'll practice, and then we can go back to the rest, so I don't bore you. I'd much rather be hands-on than talk too much. But I can talk if you haven't figured that out. That's another thing too. I had a couple of comments, not too many, that like I do talk too much during a lesson, and I allow toys, I allow screaming, noise. What I don't like is when the child's really discomforted, they're tired, where I'm pushing them. Like again, that baby was barking, but he wasn't full on. Wow! When that started to go to, they start getting pretty red. Then I start backing off. I really don't like to. I want them to realize that when the movement's correct, that it's pleasurable, not, I don't want to initiate that it's still, and there's a fine line between a child going from that it's different, because to them different is discomfort. And I have to show, that's when I really have to get very subtle to let them, it's just different, not difficult. And then they start going, and the breath happens, or things that we are familiar with.